Hello and welcome back in another edition of our Talking to the Topper here. I have the pleasure of welcoming the numero uno rank 1 of AIIMS November 2016 postgraduate medical entrance exam. We are talking to Dr. Nayani Makkar today. Welcome, doctor, and it is a wonderful rank to secure. Rank 1 in November AIIMS postgraduate medical entrance exam 2016. Congratulations to you on your wonderful and sparkling performance. How are you feeling?
Obviously this is a great feeling, and to do it in such a difficult exam in the first attempt makes it all the more great. And thank you for having me.
Well, that's really our pleasure, I tell you. And what our listeners and viewers are going to really want to know about the thing here is that how did you prepare for the exam?
I think the most important thing for any exam is consistency, and especially with the current AIIMS pattern, it is most important that the 5 years in medical school are spent continuously trying to learn more and more, and that is the key to cracking any exam.
That's very nicely answered. And you see, whenever any doctor takes up for the preparation of postgraduate medical entrance exam, time is the biggest constraint. Can you just put some light in that? How did you manage your time?
So other than whatever I had done during medical school, I put in 3 months of concerted study for the exam, possibly 8 to 10 hours a day. And the only thing that I would recommend is that make a schedule and stick to it as far as possible.
So was it a more selective or a more extensive kind of study you did?
It is extensive in the way that I would recommend to use only standard books supplemented by your own notes and nothing else.
Let me ask you here, Dr. Nayani, that how was DAMS important in your preparation?
I had joined DAMS test and discussion series, and I found it very invaluable in the preparation, both to tell me the level of preparation and to give me an idea of where I was lacking in.
Well, that's very nice to know. As we all know, the DAMS is quite active on the Facebook medium, and you were also mentioning before the interview that you had now and then visited the DAMS exclusive club. Can I have your feedback on the same?
I think they are uploading questions quite regularly, which is helpful, and these are good questions. So it is a useful adjunct. Obviously, it cannot be used as the sole mode of preparation, but it is helpful, very helpful to have around.
That's very nice to know. We also conduct the CBT. Can we have, how was your experience with the CBT or the mock test that we conduct?
So the CBT is conducted very professionally and is like an actual exam. So to have that feel of giving an exam before actually giving the exam reduces the anxiety significantly.
Well, we also conduct a DVT session at the Talkatore Stadium, New Delhi. You have mentioned that. I think you did not attend that.
No,
right?
I was not able to.
Well, just let me share here with my listeners and my viewers here that we had done a record screening of DVT this time. We have definitely entered the record books also, and the Limca Book of Records have taken our nomination for the record that has been held for a simultaneous classroom session for doctors, which is the biggest ever in the country, in the history of the country as well. Well, taking the conversation to the next level, before I do that, let me just remind my listeners, I'm talking to Dr. Nayani Makkar, rank 1, AIIMS November 2016 postgraduate medical entrance exam. We do have our evaluation system. With that, I refer to the grand test, the subject-wise test, the revision test, and also the semi-finals, mop-ups, etc. that we conduct. What is your take on that?
I think if somebody has to gain one thing from DAMS, it has to be the tests, because they are comprehensive tests. They give you your rank at an all India level, which is very accurate, and the topic wise distribution lets you know your lacunae. So if somebody just has time to do one thing at DAMS, it would be the test and discussions.
Can you little elaborate with our mop-up and the semi-finals and the grand test thing?
In the mock exam for AIIMS, my rank was 3rd. In the actual exam, my rank is 1. So that should give everybody a pretty fair idea of how accurate these tests are for preparation.
So would you say to a little extent that the questions that are given in the DAMS, that are put up in the DAMS tests and all would actually appear also in the actual exam?
The topics definitely do, and the pattern of questions is similar, so you'd learn to think in the way that an examiner would or could want you to.
Well, that's wonderful to know. And let me just ask you, which branch do you wish to opt?
I will be opting for general medicine.
Well, that's wonderful to know, and it's a great news for all our patients out there that a good doctor is about to come, and that's very nice to know. Any message before we wind up this conversation to the juniors about joining DAMS?
Yes, I think it is very important. So, while studying throughout your MBBS is important, at some point you will need to, if you cannot do all the books, the standard textbooks on your own, it is a good way to join a class with DAMS and get their notes. If you have already gone through the 4 years and wish to prepare an internship or post-internship, then the test and discussion series are very good to sort of practice whatever you have done so far.
So what I can sum up with your inputs here, that DAMS has really helped you in focusing more towards the examination and giving you the best of the knowledge for preparing for postgraduate medical entrance exam in country.
Yes,
That's very nice to know. And with that, we will just finish our conversation with Dr. Nayani Makkar here, rank 1, AIIMS, November 2016, postgraduate medical entrance exam. We wish you all the best, doctor. Thank you and God bless you.